Oh, hey,
Okay, hi.
there you go, Dr. Khan. We're all here now.
Hello.
Yes.
Hello, hi, Dee. Or Dawn. I don't know why I just said that. It's been a long night right now.
Hey,
A long
it has.
17
See,
minutes.
Yes.
we'll get it eventually, but we all made it here, so
Yeah.
this is good.
All right. Well, it's all yours, Dr. Khan.
No, I want to go ahead and welcome all the listeners and viewers to join us on a very special Facebook Live. We have Dawn and Tracy Gary. Both of them are very well known to the breast implant illness community, and they truly are in every phase of the word the warriors that are truly the voice of the many ladies that have relentlessly, day in, day out, on the weekends, their personal time, made this concerted effort in order to bring about awareness. And we will hear from them directly. And I have had a pleasure and privilege to talk to Dawn in person and do a Facebook Live with her several years ago, and certainly Tracy. She has visited me at least 5 times that I can remember and done numerous Facebook Lives. And again, a lot of time and effort and devotion. Both of the nice ladies are ladies that have gone through this whole explant phase. They understand this, and they are truly at the forefront of bringing awareness to the many people who are not even aware that breast implant illness and what are the implications of having breast implants. So, having said this, Tracy, I'll go ahead and start it with you, and then Dawn. Please tell us a little bit about yourself, about your past, what got you started, what is your story, if you will.
Sure. I was a broadcaster, mostly in Detroit, and I was 120 pounds at 33 years old, 32, 33, and decided I thought I needed breasts. So it was all insecurity. But anyway, I got them against my husband's wishes and still went and got them. And then got headaches, migraines, headaches daily, migraines several times a month. I had lower back pain, joint pain, muscle pain, chronic fatigue. The lower back pain was paralyzing back pain. Like I couldn't even roll over in bed. My husband would have to pull me out of bed, and then just like that, it would go away. It- so you wouldn't even take pain meds or anything because you knew it could just go away instantly. I think it was all linked to inflammation due to the breast implants, but the worst for me was the back pain and the chronic fatigue, the muscle fatigue, and then the depression kicked in. And then as the years went on, I think I caused a lot of that, the depression, and then it became suicidal depression. But we had a steam shower and we also had a soaking tub, which I was in almost every day, in one of those every day. And then I hear you shouldn't be heating up your body with breast implants in, because then all the toxins. So I'm sure I probably added a lot to that with the heat, because they don't tell you not to soak in jacuzzis and stuff with them in. Um, but I started losing my memory within like 30 seconds at work. I would forget my door keys at work. I'd go outside to get something out of my car. I'd lock myself out of the building. It was getting so bad. I ended up quitting both my radio and my television job, and I just stayed home. And then it just got worse, the depression. I couldn't have worked if I wanted to. I don't know how these women who are sick continue to work, because some of them are pretty darn sick. So
How soon after, Tracy, that when you got your implants, how soon after, or how many years later did you get these symptoms?
it started immediately, but I never connected the dots because I was in so much pain from the breast implant surgery. And my friend had gotten them a month or two before me. And she's like, mine don't hurt, mine don't hurt. And I'm like, I am in so much pain. Well, I think I was rejecting them the entire time. My breasts were numb for 20 years with them in, totally numb breasts. It was the worst feeling. The symptoms that started immediately was the inflammation, the weight gain that you couldn't control. Reacting to foods came along. Most of it was weight gain and the chronic fatigue, the muscle fatigue, a little bit of depression. Then 10 years in, I had a rupture and a replacement. And he got he got all of the capsule. There was very little capsule when he did my explant down in Costa Rica. So the doctor did a great explant and then put a new set of implants in because I didn't know at the time that they were so toxic. And that seemed to be when like we poked the hornet's nest or something. Now I did have a saline rupture, so I don't know, perhaps the saline was contaminated and that going through your bloodstream, because I mean, where's it going? I don't know, but that seemed to be when it really started crushing me, was after the 10-year mark when I had the replacement pair put in, and then it was crushing depression. It was awful. The worst depression I've ever experienced. And I don't get depression. I'm like Miss Happy Go Lucky, and it's all gone. 7 years I have been free. Not, I don't even, I might get a little, oh, sad, but I don't get depression. And so it was definitely the implants for sure. It came out of the blue and it all instantly vanished.
Now, what's interesting, Tracy, from my experience having talked to thousands of ladies, when they had their first set of implants and then they got the second surgery, the symptoms went through the roof. This is
Yeah.
what I call like a stirrup phenomenon. Now, can I scientifically prove it? No, but I have taken care of so many ladies. They said, I wish I had kept my first ones and not touched them, because ever since I got my second surgery and I got the replacement, I went from saline to silicone, or I got a replacement. That's when the symptoms went through the roof. And this is what I call, again, what is a stirrup phenomenon. You just basically that equilibrium, that homeostasis, you disturb it. And now the silicon toxicity symptoms go through the roof. Now, how much research did you do? How sure and confident were you that you truly were going to benefit from the explant?
Yeah, no, I had no idea it was my breast implants until I was on a boat with a gal from our lake in Michigan who was an ER nurse, Annette. You've met Annette, Dr. Khan, and
Yes.
Dawn, you,
Yes.
you might know Annette. I don't know if you know Annette Baker, but I met her. She was one of my neighbors, and so she invited me on her boat a couple days later, and she had like 10 women on the boat, and they're all asking her what her symptoms are. Have you figured out what's causing this and that? And I'm like, oh my gosh. And I said, I have all your same symptoms. You don't know what this is. And she says, well, I think it's my breast implants. Do you have breast implants? And I'm like, yes, for 20 years. And she goes, well, I think it's the breast implant. You should look into it. And I'm like, what are you talking about? I ignored her for six months. And then I wouldn't come out of the house to play because I was so depressed. I couldn't even get out of bed some days. I was so fatigued. I'd get up and just have to go back to bed. I was so tired. And so I started finally researching it like she told me to. And I was horrified. All my symptoms are all there. And then all these other women, they say it's just a small percent, but you can't say that because there's so many support pages for this now, around the country, around the globe. And one of them has almost 200,000 women on it with all the same stories. So, in these doctors, not you, these other doctors sit there and say that it's all in our head. And there's just a small percent. Well, there's 200,000 that we know of. That seems like an awful lot to me.
Right, right. No, absolutely. So, the now you mentioned initially that you were 120 pounds. During the peak before your explant, how much did you weigh?
198 with high
Yeah.
blood pressure. And I have super low blood pressure. My brothers, like it runs in our family, low blood pressure. So yesterday, for example, my husband has high blood pressure. So he took his, like, oh, take mine just to see. Mine was 86 over 65 or something, 80 over 65 or something like that. I got the two green lights, but I'm like, wow. I mean, that's me low. They usually take it twice. You sure you're alive?
Mhm.
Right.
So then active today, like running around, and I thought, I'm going to see what it's like from being active. 120 over 80 it was, or some 120 over 70 something. And so that's when I'm active. So I have very low blood pressure. It went up to 165
Right, right.
over whatever. And I thank God was in a doctor's office. I was in she was a DO, and she's the one who diagnosed Hashimoto's, which I think I had since I was a child, very mild, and then put the implants in and created the perfect storm. Um,
Right.
um,
Now, yeah. So the one thing I just want to mention is I hear a lot of my plastic surgery colleagues, and they say, well, breast implant illness is a myth. I will tell you, if you look at the manufacturers, this is our journal that we read. And if you will see, this is the mentor advertisement, and we'll have a copy of this for our viewers. As you will see, it says, and I'm going to quote, patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Now, close quotes, this in itself, they're telling you it exists, and this is coming from the manufacturer. Then let's read next. Individual patient risk for developing these symptoms has not been well established, period. Some patients report complete resolution of symptoms when the implants are removed without replacement, close quotes. So this tells you breast implant illness exists.
Yes.
And it touches a lot of these symptoms from the hair loss to the neck, back pain problems, vision, dryness of the eyes, thyroid problems, endocrine problems, neck, back pain, fibromyalgia type issues, going top down, ringing in the ears, dry mouth.
Yeah.
You have
I had
patients
all of
with,
them.
All of them. Yep,
patients with
exactly.
I had
taste
all of
changes.
those. Ooh.
Yeah, taste changes. You have chest
Horrible.
pain, palpitations,
Yep.
blood pressure issues. We're going to hear from Dawn. She was on, I think, at 3 blood pressure medications.
Yes.
You know, so you have patients with rheumatological joint problems, patients with GI disturbances, plantar fasciitis. The hallmark feature, the most common symptom being fatigue, brain fog, what you were saying, you were forgetting, memory loss, confusion. You know, and a big part of it is basically the anxiety and depression. And in your case, Tracy,
Anxiety.
this was the suicidal ideations that you had. And this is very rare, thank God, but this is where you have the many constellation of signs symptoms. And this is where you've gone to the doctor, they've run a whole battery of tests, the endocrinologist, allergy immunologist, rheumatologist, primary care doctor, they all say everything is normal.
Oh,
It's
no, they said I should get psychological help.
Yes,
Yes,
yes.
to get a
Unfortunately, they
therapist.
say this, that you're stressed out, and that it is all psychological. You need to be on medications to control your psych problems, unfortunately. And believe it or not, they not only have told the patients, they tell me because they say, why do you believe the patients when there is the underlying problem is underlying anxiety? Now, this is where clearly, you know, the other thing I want to mention here is you had a rupture. It says over here again on the same book, this is, I didn't write this. This is from the manufacturer. They tell you quote, breast implants are not considered lifetime devices, period. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. So that means that many patients, unfortunately, are told that you will die with them. You will have them for decades and decades. And if it's not a
Yes.
problem, leave it alone. And we're going to hear from both of you ladies about what is it that, you know, you have done. So you have a very classic story that all the other ladies minus the symptoms. And today I did a case on a lady, 29 years of age, and she had implants just 3 years, and she said, I cannot live like this. And she had these lupus type syndromes, positive ANA, joint problems, and she said that she was losing her mind. Same story as yours. For her, she found out, you know, in 3 years. And unfortunately, Tracy and Dawn, you had to go through so many years before you realized that it was indeed the implant. So when you went into your surgery, Tracy, how sure were you that you were going to get the relief and the benefit from the explant?
After everything that I had read, I think the support pages, the Facebook support pages, allowed me to go in a lot more confidently. It had been 20 years of having them. I thought they were too big. The replacement pair, I had asked to go smaller, and I woke up even bigger where I couldn't even fit in my work clothes anymore. I couldn't button them. So that was a problem. It what was your question again?
Yeah. So how sure
Right.
were you going into the surgery? Because you know you
Oh,
went
yes,
to.
I was quite sure. And then my husband and I decided, you know what? I wanted them smaller anyway. So even if he pulls them out and I still stay sick, I didn't want them in anyway. And at least it's one more thing we've eliminated, and they needed to come out anyway and just get rid of them. And I did end up doing a lift, and but I was pretty confident that I would get better. I
Got it. Okay.
After being on all the support pages and reading all of the information.
Now let me ask you this, and then we'll jump to Dawn after this. If someone says to you this was all like a phase in your life, your body improved, what you went through is a placebo effect, this is all in your head, this recovery, this weight loss, this improvement in your psych symptoms, what would you say to that person?
Yeah, no, I know the facts and I have proof. I can show them proof. I've got blood work, my what is it, the high def CRP, which shows all your inflammation. That was gosh, I can't remember now. It was so high, Dr. Khan. I was marked high risk for stroke or cardiac event or whatever on
Mm-hmm.
my blood work. And then 6 months post-op, I had blood work done again. It was a
I
point.
think.
It was so it was so low. It was a point 0.6.
Wow.
Honey.
Wow. Okay.
So yeah,
Well, that,
inflammation came off. I lost like 4 to 7 pounds the first week, 4 pounds in the first days. The doctor was shocked. And then the rest of it was coming off at a pound a day, all the way back down to 120 pounds, back down. And I could not get that weight to come off no matter what I did. And I think it was all inflammation, was just constantly creating inflammation in my body. And when it came off, there was thin little Tracy back under there again. And I couldn't believe it. It did take like 5 years for my face to fully debloat, I think. I want
mm,
5 years because I look at video when Devin Skillion did the first interview with me, and I'm like, yeah, look at how thin my face is. And I look at it and I'm like, wow, look how fat my bloated my face still looks. And
yeah.
it was still
Mhm.
bloat from the breast implants.
Right. Now I remember you showed me pictures. And I saw how you had significant weight gain as a result of the inflammation, the water weight that you have. Now let's go ahead and shift to Dawn. Dawn, if you can please tell us about yourself. When did you get implants, and how did you explant? Like, what was the journey that you went through?
Well, in 2014, I had multiple breast cancers bilaterally. So I ended up going with reconstruction with implants, and I did have silicone implants. And I was really sick immediately, but I was also going through chemotherapy.
Mm-hmm.
And so a lot of things, it was kind of attributed to the chemotherapy. There wasn't even a thought about breast implants being the problem. My blood pressure went from being low, like Tracy was talking about, 100/60 was pretty much my norm. And so 210/110, in some instances that was higher than that. And that was the whole 5 years that I had breast implants in place. So I was a high stroke risk. Not many people actually know this, but I was actually, I was diagnosed with early onset dementia. And I
Wow.
told them that that was not right, that I felt like I was poisoned and that I was going to get better. And I have had improvements, but it was interesting because I had to really fight to even have people believe me that it was making my sick. My rheumatologist and my cardiologist, few of the different specialists supported me. And so I ended up going to a different surgeon because my initial surgeon really wasn't sold on the whole explant thing. And he actually told me he had done explant surgery before. And then I found out that he would have a microsurgeon on because he hadn't actually done it before and he would be assisting. And so that was really, kind of devious to me. And so I went shopping for a different surgeon. And when I say shopping, I don't take it lightly. When I got them out 5 years later, um, that surgeon looked at me and she just said, "You're full of inflammation. Why do you still have these breast implants?" I had muscle spasms like 24/7. I felt like I was having a heart attack all the time, literally just from the stress and pressure of the spasms, um, constricting on my lungs and heart. And then I did have a pneumothorax. So I had a hole in my lung after I had my implants removed, which we knew was a big risk because I'm very small and they kind of spread all over my ribs. The adhesions did, the capsules. And so they really had a hard time getting those off there. And I told her, even if I have a pneumothorax, it was worth it because I felt like I was dying with implants in. And I didn't even know that's what it was, but I was like, obviously it was related. So I get them out. And the very day I get them out, um, I had a really horrible chemical smell that I had the whole time. And I blame that on chemo too.
Mm-hmm.
When I got those breast implants out, when I was in recovery, my dad came up and he hugged me And he took this huge breath and he said, "You smell like my little girl again."
Oh,
Wow.
Yeah. So I would be in restaurants and people would even notice, they'd say that something spilled,
oh
there's a
my
horrible smell.
gosh.
And it was me and my chemicals. I didn't realize every time I went in the sauna to detox that I was basically, cooking up all these great toxins and heavy metals
Yep.
and putting them through my body. I was out in the desert. I was in Vegas, all these places where it was 100 degrees or more. I was literally on the ground thinking, I was praying I was going to make it.
Yeah.
So how
So,
many symptoms, once you explanted, what symptoms improved? What were how did you see that gradual improvement, or sudden improvement?
well, the fatigue was a big, big change right away. I still have fatigue, but it was like a different person, the energy level. And
Mhm.
I had shingles 12 times when I had breast implants. So over a 5-year period, I had shingles, a couple times a year, a few times a year. And when I got my breast implants out, I've never had shingles again, except after I had COVID because my
Mm.
body was all fired up. But if you want to talk about inflammation, I mean, having shingles that many times over and over, my doctors didn't know what was going on. My rheumatologist is like, you don't see people get shingles over and over and over. So my
Mm.
inflammation was through the roof. That went away. My heart palpitations went away. I had really severe night sweats that literally soaked my whole bed. I'd have to get different towels and layers and swap out. It was horrible, Tracy. And it kind of makes you feel like you're losing your mind, because there's so many symptoms going on. I
That
had
causes you to dehydrate too.
Yes, it literally feels like you're kind of getting pickled from the inside out, and that really causes a lot of the cognition problems too. Um, I had painful ribs. I had flu symptoms every single day,
Yep.
and I still deal with a little nausea, but nothing like. And I literally had flu symptoms every day having breast implants that I fought through.
Mhm.
Hot and cold intolerance, so I could be at a store or something, and I just have to sit down on the floor and just be in a huge sweat ball
Mhm.
out of
Now,
nowhere, not
now
overexerting
you.
myself. I could be in an amigo cart and it would
Mm.
still happen. The overstimulation got so much better. I had numbness and freezing, just overall in my skin, not just in my chest. And that went away. And my cramps, spasms, the feeling that I'm going to have a heart attack, that's very minimal now. I get spasms. Right now, I'm going to therapy again to kind of calm it down because of adhesions. But
Mhm.
that basically went away. And
Right.
just overall feeling better
Now tell
was
us about the blood
crazy.
pressure. Like I remember you last time. Tell us about the blood pressure post-op.
Yeah. When I went post-op, I actually had to have 2 injections to bring my blood pressure back up. Um, they My blood pressure dropped so much after my explant surgeries, and the surgery after that. They told me, I needed to contact my cardiologist right away. There was no way I needed to be on 5 meds associated with my blood pressure, because there was 3 actual blood pressure meds, and then there was a couple different ones that they threw me on, just try to see if it would help my blood pressure. That could have helped my blood pressure. And so now I just got decreased again to 20 milligrams of lisinopril a day. And we're talking about maybe getting rid of that, because I actually am POTS symptoms now. So now I have really low blood pressure and it goes up, but it doesn't go up anywhere near having breast implants with that inflammation. It was just insane. You could see my heart busting through my chest. Not just like palpitations, but my blood pressure was so high. I mean, I would get purple and just, it was insane. So many huge things got better when I got them out. It was like a miracle. And I'm still, I'm 5 years out now. 2019 is when I had my explant. And I'm still getting tubes in my ears. A lot of people I know have ear problems too, eye vision problems from inflammation and dryness. So I have a lot of specialists I see, but I don't feel like I'm dying on a daily basis. I don't feel like I'm
Mhm.
dying more than anybody else now. I just deal with things. So for me, I thought it saved my life having my breast implants out. And that's why we're working so hard, to make sure everybody knows what can happen when you have breast implants in.
Mhm.
Not all the time, but many times it does.
Yes. Now, Dawn and Tracy, please tell us what you have done with the Michigan legislature. What is it that you have done, behind the scenes?
Can I talk first, Dawn?
Yes.
Yes, you may.
I'm gonna say I met Dawn through the support page, right? The Michigan support page.
Yes.
And we met up at the Capitol building. We went up to the Capitol in Lansing and we all talked and tried to enlighten people about breast implant illness and try to get them to push this bill through. And I'm telling you, I have hardly done anything, Dr. Khan. Seriously, I am riding on her coattails. So I just want her to get all the kudos that she deserves because
Oh,
this has been such hard work that Dawn has done this entire time. And I would love to take credit, but I cannot. I am just like riding along, and half the time she tells me she needs me to do something and I'm like, oops, forgot. So this is all Dawn, and I am so proud of you, Dawn, for all of your hard work. And I really do appreciate what you're doing for the state of Michigan. Oh my gosh. So go
thank
ahead,
you.
you big little superhero, you.
Thank you so much, Tracy. I appreciate you and your help and your friendship and everybody that does just a little bit. We're all doing our part to make sure that people know. And your podcast and doing lives, you definitely get that awareness out there. And I appreciate you being on my
You
legislative
are
team and my friend.
Thank you.
It's been, we've been doing this a while now. This is like our 5th year. First it was House Bill 58A1.
Yeah.
And
It's a game of
Julie
chess we're
Kelly
playing.
Yeah, Julie Kelly, she ended her term. So we kind of got it tossed up with another rep that had other things going on. And now we have House Bill 4298. And it is for true informed consent for breast implants. So these people will get this information at their consultation. It won't be prior to surgery, here, sign this real quick while we got your chest all markered up with our doodads and doodles. No, it's going to be a consultation, and these people are going to have time to go over this information, and it is going to be a verified checklist, and these surgeons are going to have to sign, however, electronically, physically, and acknowledge that they have given all this information to these women and everybody that's getting breast implants. There's lots of people that get breast implants.
So has this bill gone through? Has it been passed?
No, it is actually we're going to talk to the House Health Committee chair on Monday. And so this is our 3rd round getting it up. It's just timing would always not pan out quite right. So this time we're hoping it will go through. Amos O'Neill is heading our bill, and we have a lot of great support. We're hoping that this is going to be quick at this point. And Mary is Amos O'Neill's assistant, and she's hoping it will too. We have great support. And really, this is one of the most exact, descriptive, and containing, we tried to contain as much as we could into this bill, working off of different work, our first bill, but also Arizona, California, Washington, and learning from other states that are going through the process of doing this bill too. So, really
what
happy.
exactly?
Yeah.
So Dawn, what exactly is the bill? Like, if you can explain in a little bit more detail, what exactly is it that's going to mandate?
So they're going to have to go over everything with everybody. Let me just bring up a version that I can read better. Where right now, there's a little warning that says that you're supposed to go over stuff. There's not really any penalties. They get fined or something if they don't inform these patients about what can happen with breast implants, and that there's a black box warning included. I hardly talk to anybody that have been given the black box warning until just recently. So that's 11 years. So I find that interesting. But yes, in the state of Michigan, it would be January 1st, 2026, that any surgeon that will be doing breast implant surgery without first disclosing this information and going over all of this and following and obtaining the patient's written informed consent, it will go through the public health code as far as disciplinary goes. So there will be a disciplinary action, as far as a fine, suspension, revocation. If somebody really, why would somebody do that when it comes to somebody's health? But, it has to be done sometimes. This will make sure that they have materials in their hand as well, not just a verbal kind of run through It's very overstimulating when you're in there. So this will give multiple ways that they're going to have the material in their hands and on paper, and they can ask questions. If they have a question, they would, and it's on a paper, they have to ask a question and get it answered. They can't do the surgery without having other questions answered. But then there'll actually be a board of advocates and doctors and physicians that will be judging cases and how to do this and how to punish people basically too. But there will be a statement talking about the FDA with their black box warning that will be in there too. Information about breast implant illness, BIAL, squamous cell carcinoma. Let's see here.
Oh yeah, we forgot all about that.
Yeah, that's a whole other
Those minor details
but
that come with
they're
breast
all in here.
implants.
They're all in the bill. All these women, cancer patients, everybody that's going in for breast implants, they will know these things now. So where a lot of people don't even get that black box warning, it's going to have multiple resources, and they're going to have all the information, and then they can choose, hey, do I want this? Is this right for me? I have autoimmune disease.
Right.
This might not be good for me, because that will be in there as well. Hey, if you have these conditions, they might be exacerbated. So it really touches everything. And the biggest thing is just having patients informed so they can make the decision that's right for them.
I'm going to jump in, Dawn and Tracy. I just want to say, as a physician, clinician, one of the most personable things that anyone can do is to offer a patient surgery, because what could be more involved than this? And I have to say, it is a shame that the surgeons will operate on patients, put implants, and not do the informed consent, because that in itself is unethical, period. So the many patients that I've seen that come to me and they say, my surgeon said that these are lifelong devices, incorrect information. That on Monday, I saw a 75-year-old lady. She had implants, 600 cc's from breast cancer, and she had rheumatoid arthritis. She went to a local top-notch plastic surgeon right here in the Bloomfield Hills area. And that surgeon told her, I will remove your 600 and we will put in another set. And because she has rheumatoid arthritis, it is a contraindication in putting in implants in her, and she should get the implants out. And she had fluid around her implant on the MRI. And so that in itself is a alert. She had BioRads 4 category MRI done, which means there's suspicion for cancer. And there should be a total commitment to removing the capsule. And so, first of all, the point number one and I'm going to make 2 points. It is wrong for any surgeon to put in implants without getting the informed consent. So for someone to operate on a patient, regardless of this bill or any other bill, for any surgeon to offer a surgery to the patient, they must say to the patients, exactly what's written on this and exactly what you read, the black box warning. Quote, breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. This in itself basically is contradictory to all what the patients have been reporting, that their surgeons. So not only are the surgeons not telling them, they're misleading them. So there are two problems with that, and as you will see, patients, basically it says over here, safety and effectiveness have not been established in patients with autoimmune diseases, for example, lupus and scleroderma, a weakened immune system, conditions that interfere with wound healing and blood clotting, or reduced blood supply, such as diabetes, or reduced blood supply to breast tissue. Patients with a diagnosis of depression or other mental health disorders should wait until resolution or stabilization of these conditions. So the point here is, this is all should be, from the beginning of time, should have been very openly discussed. So the surgeons, not all, but the vast majority of them do not discuss, because the patients tell me, I was never informed that they're not lifetime devices that there have a association, very rare, with the BIA-LCL, which is the breast implant
Yes.
associated anaplastic large cell lymphoma. And you mentioned the BIA, breast implant associated squamous cell cancer, very rare, but it does occur and it is underreported. The BII issues, the rate of rupture amongst with the infection, acute and chronic pain, capsular contracture, the ability to get screenings, for example. So that's the first problem. Not only is the informed consent not being done, it should be done regardless of this bill. And this bill certainly will mandate and punish those surgeons who do not discuss. So, for example, the patient that I saw today, 3 years ago when she had her augmentation, she had no idea that this could even occur. She thought that they were very safe and there was no contraindication. And it was like a quick, what date do you want? The second thing I want to mention is when the black box warning came out, this was issued by the FDA. And I want each and every person who's listening, and I'm going to actually read, I have it pulled up on my computer. The FDA, and I quote here, the patient decision checklist. This checklist provided with the breast implant and required to be reviewed with the patient by the physician helps patients understand the benefits and risks of breast implants, including potential complications. So this is what the FDA, when they came out with the black box warning, they told not the physician assistant, not the medical assistant or the nurse, but the physician to sit down and have them do a checklist. So they basically said the FDA mandates that the breast implant manufacturers include specific information, including a black boxed warning and a patient decision checklist in their labeling to enhance informed consent. So this was, again, never followed through, which the FDA mandates. And unfortunately, you have to do this bill. And even now, when this bill, if someone, a plastic surgeon, does not discuss with their patients the prospective pros and cons of getting implants, it will be considered illegal and unethical, and they will be responsible for not sharing. So this is where the patients, if they're making a true informed consent, they will be required to sign what you said. They will be required to sign on the document. Hopefully that will get passed soon. And this is a no-brainer bill. Any person who gets like a hip implant or a pacemaker or open heart surgery or whatever procedure, even a root canal, for example, they have to have the informed consent of all the risk versus benefits. We live in a civilized society, and these are risks that must be discussed openly with the patients so that they know what they're signing up for.
Yes, and in the bill, we really wanted to make a point that at any time that we need to add extra cancers caused by breast implants, like T cell, B cell, melanoma, and any other cancer that may be caused by breast implants can be added at any time. And same for if there's any other reason why you might have a higher risk for having breast implant illness from having it. We're going to add that to it at any time too. We can amend this at any time to add anything to help save people the trouble of these health problems.
Right.
So.
This is a very important point, Dawn, what you mentioned, because the literature is saying it's not only the BIA SCC, which is the breast implant associated squamous cell cancer, or the BIA ALCL, which is the breast implant associated anaplastic large cell lymphoma. The literature says that there are many other variations of T cell, B cell lymphomas associated with the implants, many of which we do not even know of, because in the world that we live in, no plastic surgeon is committed into removing the capsule. No, even when they remove the capsule in those rare circumstances, do they send the capsule off to pathology? Even when they send the capsule off to pathology, they're not doing a CD30 analysis or ruling out all these other potential lymphomas, and they are very much underreported for that reason. And this is why when a patient gets an explant, the capsules I always send in my practice to pathology. If there's any fluid, I always send to cytology, and I take cultures for aerobic, anaerobic, and fungal, so the patient gets their complete definitive workup. So let's say if a patient gets her surgery today, the two ladies that I worked on, I operated on today, they have that absolute peace of mind that all of that capsular tissue was removed, number one, and number two, all of it was tested so that they have the peace of mind that they're not going to have any surprises later on.
Dr. Khan, do you remember me telling you about a woman named Kimberly Dom who played bass for the band Boston? And she had a rupture and I think it was a rupture, and she was going to get a replacement set. And when she was in surgery, the doctor was removing them and he found
I remember.
seromas and all kinds of odd looking fluid. So he sent it, thank goodness, to the lab, but then continued to put brand new breast implants in, even though things were suspicious. And she went
I
home with
remember.
brand new breast implants, and the test results came back that she has the cancer BIA-ALCL.
And then she had to go
And then
back
had to
to
go
get,
get them removed.
Yeah.
yes,
And
and then you
insurance
had
won't
to,
pay for it, I don't know if
yeah,
insurance paid for it because it was the BIA-ALCL, but they could have probably said no. I don't know if they,
Right.
but yeah, it's just a few of us though, right?
right. And guess what? Last year I had 3 ladies with CD30 positive. I sent them straight to Carmanos, the other local cancer centers, and I will tell you, it is certainly very much underreported because you cannot look
Two or
at
three.
3. So 3 patients with CD30 positive. And so just to let you know,
So
because
scary.
when I moved to, and so these are patients, because no one, by looking at it with their eyes or even their magnifying loops that I use, I cannot tell if it's cancer or no cancer. And so you have to do that stain. And only when you tell the pathologist to rule out that BIALCL or any other lymphoma, then they go pertinent negative, pertinent positive, meaning they say it is or it is not. So let me give you the example. Right across from my surgery center, that there is the Trinity Hospital. I went to the head chief pathologist and I said, I want each and every single capsule that I send must be tested for CD30 positive, and you need to write down no associated pathology related to the implants. So he said, well, do you want me to go ahead and do that? And everyone, even though when I look under the microscope and I don't see anything suspicious for cancer, I said, let me ask you, and he did not want to do the CD30 analysis on everyone. I said, can you tell me if you did 1,000 of these, could you potentially miss CD30 positive because you did not stain it? He said, yes, that's possible. I said, guess what? I want every patient to be treated like the president, the full test to be done, and I want you to document that I am mandating it, and I write it down on that request requisition form. CD30 analysis must be done so that my patients basically feel comfortable and confident that they got the full test. And my pathologists, who I know personally, I have talked to them at the pathology department at the hospital. I said, I want you to do all the tests, whatever, because these patients are coming to me from all over the world, and I want you to tell them that they do not have this lymphoma or anything other associated. So from my patients where I removed the capsules, I have had, and I can remember patients with breast cancer that was picked up on the capsule. I have patients with with lipomas, fatty tumors, patients with CD30 positive, patients with fungal infections. So this one patient from Washington State that I managed last Friday, she had a candida infection inside her capsule,
Oh,
and she's going to go see an infectious disease doctor. Had I not sent the cultures out, we would not have known. Another lady from New York, I talked to her just on Monday. She had candida infection, and her infectious disease doctor, who I talked to from Long Island, wanted her to get 10 days of IV infusion therapy for that
oh,
antifungal. And the point here I'm trying to make here is I cannot tell by looking at it. That's why you have to have removal of that entire capsule and complete workup with aerobic, anaerobic, and fungal, so that the patients have the peace of mind, so they don't end up like that patient who had that fluid, who had that lymphoma, and now has to go back and remove the implants and do a complete total capsulectomy with anything inflamed that needs to be removed. Because any patient who has that BIALCL, the surgery of choice, and the surgery, the standard of care is to remove the entire implant, the entire capsule, and all of that inflamed tissue and all of that fluid, and such that none of that remains behind and that all of it is tested. And you want to assume that the capsules that are removed, they're all tested so that you're not second guessing your surgeon or second guessing the process, so that you know that all of that capsular tissue was checked. Now, let me give you another example. I had a patient that came to me and she said, she had breast cancer, and she said that if you process my capsule through another major lab carrier, and I will not have to pay because my insurance is in contract with basically that pathology department. And when we sent it over, they said no cancer seen. That was one line, and that was it. There was no mention CD30. There was no mention that there was no malignancy present. And it is important for the pathologist to know that we're trying to rule out the BIALCL, SCC, and other many cancers that are associated that we do not know of.
Yeah, I don't think mine were tested. I know mine were not tested. I think he only tested them back then 7 years ago if he thought it was suspicious. And I think you're one of the few doctors that automatically just tests. I think you're one of the few. If you could be the only one who automatically tests. I don't know of many
I
that
will
do it.
tell you, I will tell you, during COVID time, there were people who were doing COVID tests every day if you worked at a federal government, right? Don't tell me you cannot do a CD30 test in order to rule out a cancer that we all know as plastic surgeons, as medical doctors, and as the FDA that it is underreported. They tell you because no one is checking for it, and it is being missed. For sure. How much, I do not know, but for sure, every surgeon should remove so that we know that the patients have that peace of mind. We know of a case report, for example, where a patient had her explant done, the capsules were left behind. 4 years later, that patient ended up getting BIALCL, and that was a case report. You do not want to be that case.
Right.
And then later on, dealing with lymphoma, that certainly should have been corrected. Yes, it is. I don't want to use the word overkill. It is complete to remove the capsule every single time, so that if I were to get this surgery, I don't want to be shooting in the dark and saying, oh, I wish my surgeon had. And I will tell you, there was another patient that came to me and she said, can you send this overseas, or to Europe? I will tell you, the United States labs are very different and sophisticated, and there's a certain standard that we have here. I've seen medical records from Germany, from Switzerland. They operate at a different frequency. Their medical workup, processing, pathology is certainly very much up there, but it's still different than what and where I was taught. Because we can see it in the medical reports that the patients come in. Now, let me ask you a question, a side question, but a very pertinent question. If 100,000 ladies, this question goes to Tracy first and then to Dawn. If 100,000 ladies get breast implants today, May 1st, 2025, how many of them are eventually going to have trouble?
I'm gonna say, I'm only basing this because I have a couple friends who have them and just don't appear to be even reacting at all, and they've had them like 20 years. So I'm gonna say, I'm gonna guess.
Eventually.
Yeah, I think they're silently causing problems and they just don't know it, but what can you do? I would say all of them. I'd say all of them. I
How
think
about you, Dawn?
virtually all of them.
I would say 100% just because there's another surgery. You don't, that could be anything.
So I'm gonna read the answer, not my words. It says over here. See, the answers are right here in this book, and this page, not the book. Excuse me, not the journal, and on this page, and the bottom half, because the top half is the advertisement. It says over here, and I read this earlier, breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. So remember, on average, they last 10 to 15 years, right? So I have the 2 weeks and 3 days ago, I operated on a lady, 89 years of age.
Yeah, I saw
89.
that.
Yeah. Now she came to me, and if you looked at her chest, it was pink, irritated, and she said, I cannot sleep. I am having pain. And I looked at her, and she's 89. And I looked at her and I said, no one should have to breathe like this every second of their life and have to be hurting like this because it is inhumane. It is wrong. She had grade 4 capsular contracture. And because one part of me was saying she's 89, leave her alone. She's had this since 1973. Leave her alone for like 52 years. Why are you going at someone? And I will tell you, I want each and every single one of you go to the April 14th, 2025 Facebook Live that I did from the hospital. And I did her case at the hospital. I want you to go see that April 14th, 2025 Facebook Live on my private breast implant illness or even my YouTube page. And I want you to see why I did the surgery in her. And believe it or not, if you see her, she did not need drains and she did not need a lift even at age 89.
Nice.
And the point
Very
I'm trying
good.
to make here is, look, 50, and she wanted to do the explant for the last 3-4 years, but now because she got cornered, she had the pain. Who knows? This could have basically gotten secondarily infected because things were changing. There was a lot of fluid on the inside. The capsule was almost 1.7 centimeters thick, that thick, and it was a very large implant with a lot of fluid and a lot of quote inflammatory fluid on the inside. And the point here is, sooner or later, someone will get capsular contracture. Not all of them, 8, 10, 13%. Some of them will get acute and chronic pain. Some of them will have rupture. Some of them will have BII symptoms, not all. Some of them will have inability to detect breast cancer. Remember, 1 out of 8 or 9 women will get breast cancer, and now the implant. Some ladies choose not to get mammograms or cannot do a good self-monthly breast exam because the implant is masking a good exam. You will see patients complain of malposition. Some patients have, referred pain as a result of the implant because it's impinging on a nerve. And eventually, as you will see, patients did great for 10 years. Now, all of a sudden, from nowhere, symptoms arise, and now the patients are hurting. And so, if a lady in her 20s gets implants, she will need to get this replaced on average every 10 to 15 years. So it will be at least 4, 5, 6 times before in her lifetime she would have to get that many replaced. And majority of the ladies do not know. So Dawn and Tracy, what you're doing here, this bill, this legislation that you're going to pass, is only going to reinforce what every plastic surgeon should already have been doing from the first that they were practicing: informed consent, so that the patients can make a reasonable, wise decision. Now, I will tell you, if I were to sell you a car, and we live in the Motor City, that this car has transmission problems, axle problems, light radiator problems, problems with the tire, problems with the transmission, would you go buy that car? You would not even
Car's
look
a
at it.
lemon.
And
You
this
want to
is,
buy it?
Right?
and
No, thanks.
yeah, and so this is the same thing with an implant. If you tell the ladies the hurt and the misery, and look, this movement that these are the gummy bear. Well, if you just look at my Facebook lives, you will see the gummy bear is not gummy anymore, and it's the same rupture that we have seen many times over and over again. The implant is completely disintegrated. It's like wet slime, and it is nothing gummy. There's nothing gummy about it, and it causes the same hurt as the many patients who have had the older implants, and even saline implants cause the same hurt as the silicone implants and the ruptured silicone implants. So the point here is, these devices, any patient who listens to your legislation that you're going to get passed and enforced in their right frame of mind with reasonable informed consent decision, they would and should not even think about getting them once they're made aware of these symptoms that you're going to alert to them. And I like how you that you basically left the option open of the other problems that these implants will cause, like melanoma, because that is something that needs to be discussed with the patients as well.
Yes. I don't think a lot of people think about breast implants when they think about melanoma, but I have multiple friends through this community that have experienced melanoma with their breast implants. And also, as a patient, and I've talked to other women too. I was told that my breast implants after cancer wouldn't affect my MRIs to check for cancer in the future. And imagine how my heart just sunk into, my heart sunk when they went over my scan and they told me, well, we really can't see around the implants at all,
Oh, boy.
but around the implants, it looks okay. What? So every time they would say that.
Yeah,
And so know that no, your breast implants don't make a MRI great. They do impede seeing what's going on in there. And in this time that we've been working on this bill, there's already been a young lady here in Michigan that's an influencer that has been diagnosed with breast cancer at a young age, gotten breast implants, not knowing what could happen, got deathly sick, got them out, and said, why isn't this bill passed? I would have known this. I would have never gotten breast implants. And so to me, I'm like, every day there's somebody that we could be saving with this bill being passed. And so with you guys, with your advocacy, and Dr. Khan with your lives, and going with all the truth, because you get the truth out there. That's what's really going to help save people too. And I appreciate you guys, both of you.
Now, let me ask you this, Dawn and Tracy. If someone says to you, you just remove the implant, leave the capsule behind, what do you have to say about that?
I tell them to find another doctor who
Exactly.
who is experienced and has the skills to remove it properly in an enbloc fashion. And they say no. And I say, well, you're probably just going to poke the hornet's nest and you're going to stay just as sick, if not get sicker. I recommend you find a new doctor, but I'd say most of the time it falls on deaf ears.
Yes, because I just say, if they say anything contrary to, getting the capsule completely removed, then that's not the surgeon for you. You need to go to somebody that's more comfortable and more experienced, because if they were, they would know that that capsule needs to be completely removed.
Yeah.
Why does the capsule need to be removed?
You're leaving an inflammatory scab in the body right above your main organs. You got your blood flow there. I can't imagine the problems I would still have if that was left there, just because the inflammation, it took years just for my face to go down.
Right.
So, and that's external. So I can't imagine what the internal was.
Well, and I don't know if people actually know what the capsule is. Like if you're listening and you don't know what the capsule is. So when they put the implant in, like within like a couple days or something, right? Hours, Dr. Khan, I think your body will protect you by wrapping it in a scar capsule. It'll wrap tissue around it to protect you. Actually, it's like your best friend, because when it ruptures, a lot of times it keeps the silicone from spreading into your breast cavity, which then Dr. Khan has a really fun time trying to remove all that silicone, because when you watch the videos, it's like ooey gooey sticky on his gloves and you can't get it out. So the breast implants are full of like over 40 heavy metals and toxins. There you go. And then your body's absorbing that. You're absorbing that. And so is that capsule that's protecting you is absorbing all those heavy metals and toxins. So these doctors that just, there you go. They poke you, they'll slice you, and they'll just pull that implant out and they'll leave that capsule in there. And it takes a microsurgeon and a very skilled surgeon to go in there and do a proper explant surgery en bloc. You can't just do it, but it's because it's all toxic. It's all absorbed, all the toxins from those.
Absolutely. So whenever there is any foreign body, a pacemaker, a port for chemo, a hip implant, in this case, the breast implants, the moment the implant goes in, and it's very well studied, so this is not like guessing. The moment the implant goes in, the body recognizes it as foreign and acute inflammation starts, because the body in itself, now over the next 6 to 8 weeks, the capsule forms. And because we have removed, when I was in my training, implants like 2 weeks later, and the capsule had not formed because the body is still kind of mounting that scar around. So 6 to 8 weeks later, depending on the patient, the capsule forms, the scab, the scar around. And so what happens is the silicone leaches into the periphery and gets entrapped by this capsule. This is like kind of a scar tissue. And, you can actually hear it as I cut through it. Now, what happens is, if you will see, now this is the ultimate proof. you look at not all the pathology samples where the capsules are sent to pathology, you will see the pathologist says, I see breast implant particles within the capsule, histiocytic reaction, giant cell reaction, foamy macrophages, non-polarizable material consistent with silica. So that silica leaches into the capsule and embeds within. So it's kind of like a filter, if you will. So if the implant is removed and that capsule is left behind, you will see not only by pathology, the patients themselves report that they are partially improved, some as if nothing happened, some report that their symptoms are worse because you disturb that equilibrium. And so only when these ladies go to another surgeon who's seasoned and experienced and who does residual capsules, just like Tracy said, only then do these patients improve. So if you find a surgeon who's not a believer in breast implant illness, who's still augmenting, who does not believe in removal of the capsule, run. In my practice, I say do it right, do it once, do it with confidence, and you want to have talk to the previous patients of that surgeon so that you have that utmost sincere confidence that number one, all of that capsule is sincerely, honestly, definitively removed, and number two, all of it is tested so you're not second guessing your recovery.
Yeah, it is a surgery that I'd say you get what you pay for because most insurance isn't paying for it. And you definitely get what you pay for. If you go cheap, you're going to end up probably still very sick because the doctor's not going to know what they're doing. That's why they're so cheap, because it's a big, long, tedious surgery.
So on average, I book everyone for 4 hours plus minus whatever length of time it takes for me to doing the surgery. And remember, it's all about that finesse and care. If I
Right.
give like 100, let's say, plastic surgeons a piece of paper, and I say, here's a marker, and I want you to color this white piece of paper like dark black with that black ink. Some of them will be scribbling like all the way through and be done like in a minute. Another one, 5 minutes, done. That person who takes 30 minutes and does a nice, pristine, very delicate, very defined from his heart, like he cares, like his life dependent on it, that's the surgery. And that pneumothorax that Dawn mentioned, yes, it is a risk, but you don't want to leave badness behind and because it was too tough. If it's not coming from the heart, you will see the surgeons will not do it completely because they're not sold on it. And this is why one free soldier is better than 10 hired ones. If you find someone who says, well, I don't believe in BII, but I will go ahead and do it because I want to earn your business, that surgeon will never do it because when the going gets tough in the operating room, they will bail out because when it is hard surgery, it is definitely involved and it will tax your neck, back, your eyes, your concentration. Every time I come out of the operating room, I feel like I ran a marathon. That's how involved it is because it is physically demanding.
Yeah.
And mentally demanding as well. And remember, for a surgeon to give up augmentation, which takes 1 hour, the explant surgery takes 4. I say to you, no foolish surgeon is going to basically give up unless they truly believe in explant, because why, in the time that it takes me to doing one explant, clearly I can do 3 augmentations, and that I would up my financial intake 3 times. And this is that whole do no harm commitment. Now, I just want to go ahead and mention one thing, and Tracy, I will have you wrap up, and then Dawn. Do your homework. Don't rush into it. Network, talk to people. Don't be influenced by another like liaison or a nurse practitioner. Talk to the surgeon, him or herself. See what their track record is. To have how many explants they have done. What's the quality? Do they have a Facebook page where they're actively allowing their previous patients to talk to their prospective patients? You should have that peace of mind such that when you do sign up for surgery, you're actually excited about the surgery. And this is a surgery where when almost all the patients that I can think of have said 2 things. They wish they had never gotten implants. And number 2, they wish they had removed them sooner. And you want to have that confidence. You want to have that internal sixth sense confidence that this is your right surgeon. Don't rush into the surgery.
Right. Yeah, yes. I agree.
Yes. Tracy, I will, and Dawn, if you want to, please go ahead and say some words, and then we'll have Tracy finish as you wish.
Okay. Well, thank you both again for having me here. And thank you for your support. And as the time comes up, after we talk to the Health Policy Committee Chair, and we need phone calls or support or testimony, I know you wrote us a letter as well. I will let you guys both know what's going on. And I just appreciate your advocacy and everything you do. You save lives. So
So I just want to mention what Dawn said is huge. It's the most important thing. If you don't speak up, no one's going to bring about the change. Dawn is our leader. Dawn is my leader. If I through this Facebook Live, maybe I touch 20 people, but you will touch hundreds of thousands of people and millions of people, and I will use the word millions. There are approximately 30 to 35 million people with implants. We're talking about Michigan only, but hopefully, you never know, Ohio follows us. Kentucky follows New York and Massachusetts, and you will see we want to start this momentum in Europe. The unfortunate consensus in Canada is explant surgery is
Unnecessary.
unnecessary. It is too much risk, too expensive, not worth it.
Too extreme.
And it is the same thing that's voiced by the plastic surgery societies here in the United States and in Europe. And it's frowned upon, and everyone says that I and all the explant surgeons are trying to fearmonger and capitalize on patients' insecurities. If anything, just go look at the 14,000 patients that are on my Facebook page and you hear them out. So I want each one who's listening to write to Dawn, work with Dawn, hold Dawn's hand, go show up in Lansing, talk to this. And I promise you, your one vote, they say on election day is equivalent to like, a vote that counts. I will say each one who writes, their vote is like a million votes. And if you were benefiting from the implants, write that down too. And you will see, because we need to give them feedback, because the information that I've gotten from these leaders as well, we have not gotten true feedback in regards to the detrimental effects of implants. So go ahead and write, and what Dawn said, your 5, 10, 20 minutes to basically generate a note and saying how you were benefited or harmed by implants, either or, whatever you want to do, write to them, write to RFK, write to the state legislature, make some noise so that the next generation, that your neighbor doesn't have to suffer, you don't have to suffer, your daughters, your aunts, your professors, your doctors don't have to suffer. No one should have to suffer. And that in this case, we have a defined problem and truly a defined solution. And so what Dawn said is very critical. Write and take that initiative, and don't underestimate what Dawn said, because your words will influence decisions that will ultimately translate into a better quality of life for millions.
Yes. Thank you so much for that shout out for support. We need that support.
Yes, write your letters, everybody. Yes, and I want to say thank you to both of you. Dr. Khan, I met you, 7 years ago, I think, or 6 years ago, 2019, after the FDA hearings. And you are like one of the biggest doctor advocates that we have, and one of the most caring doctors I've ever met. I feel like tearing up right now.
I'm just doing my job.
I'm gonna.
Yeah, you are.
You're not. You are, but you're
above
going
and beyond.
beyond. You go above and beyond. You're pretty special. You're a special
No, thank
man.
you.
I'm tearing up. I'm sorry. You really are. And Dawn, all your hard work. Thank you so much.
Oh, thank you. I love you guys. Teamwork makes the dream work.
I'm sorry. I didn't mean to cry, but you guys mean so much to me. You guys work so hard and you try to help warn everybody, and I really appreciate you guys.
No, thank you.
I must have taken
Love you
too much
guys.
estrogen. I think I took too many hormones.
Oh, it's something that we're passionate about. And so, I tear up too. It's okay. We're human.
Dr. Khan you are constantly warning people. You have never implanted. And Dawn, you're such a warrior too. And everything you've gone through, Dawn, oh my gosh.
Well, thank
There's a
you.
reason why God left you on earth with us.
Mm.
This is
Thank
it.
you. There's a plan.
Thank you, you
Thank
guys. I
you.
love you
No,
guys.
no, thank you. Thank you very much. Bye-bye,
We'll meet
Tracy.
again.
Bye. Yeah, we will meet again. Thank you,
Thank
Dawn. Take
you.
care. All the very best. Bye-bye.
All right.
Bye-bye.
Thank you, guys.
Bye-bye.